In 24 hours, we'd gone from planning a welcome home celebration to planning a funeral. Our lives were completely turned upside down. Two emotions overtook us: grief and anger. Josie was 18 months old, the youngest of four. She was taken to the hospital after suffering from first and second degree burns from climbing into a hot bath, and was in the pediatric intensive care unit. And she was healing beautifully. Her doctor came and took out her central line, told us we were going home in 2 days. So they gave Josie the medication, and then the next time I looked at Josie, she was out. They told us we needed to pray. The next morning, a team of neurologists came and examined her, and they said, she's brain dead. She's not going to survive. We said goodbye to Josie. We took her off of life support, and we just held her for the last time as she died. If the residents had noticed, her weight had dropped significantly in 24 hours, she'd be alive. If she'd gotten a drink of water, she'd be alive. If she hadn't gotten the methadone, she'd be alive. If she died from a breakdown in the system, she died from a breakdown in communication. 8 months later, Hopkins offered us a settlement. They offered us money for the death of our daughter. And after we learned about the deaths from medical errors and the effect and how many people die, it was very clear. I mean, we knew we were going to create a foundation. We were going to call it the Josie King Foundation. Our mission was pure and simple. We were going to do whatever we could to prevent patients from being harmed or killed by medical errors. And that was 10 years ago. It is time to all come together, patients and families, hospitals, doctors and nurses, the government, the insurance companies, businesses. We've got to come together, and we've got to do it, and we've got to do it now. And we cannot keep going at the pace we've been going.
Today we're announcing the new Partnership for Patients that will bring together hospitals, physicians, nurses, employers, unions, patient advocates, health plans, and others to improve the safety of healthcare in America. Now, to get started, we're setting two ambitious goals for the next 3 years. First, we're committed to reducing preventable injuries that happen in hospitals by 40%. That would prevent 1.8 million injuries and save 60,000 lives across this country. Secondly is to cut hospital readmissions by 20%, saving more than 1.6 million patients from complications that force them to return to the hospital.
The Partnership for Patients will be reaching out, public and private partners together, to help hospitals and their staffs learn how to make care safer and to adopt the best known practices as quickly as they possibly can and to adapt them to their local circumstances.
And that's why we're announcing today that we'll commit up to $1 billion in new funding from the Affordable Care Act toward those two initial goals. And I look forward to working with our partners across this room and across the country to work toward the day when no patient has to go through what Sorrel and her husband did ever again.
A lot of hospitals are doing really great things. I think we are safer. We're moving in the right direction. Partnership for Patients is going to help push it over to the next level.